Have you had a weird mammogram where you went for a regular mammogram and they call you back because they need more pictures and maybe an ultrasound? Has that happened to you before? Did you ever fail the ultrasound too and need a breast biopsy? I had a bad week last week, shipmates, and that's what happened to me. I've never had a needle biopsy before, but I need one in 2 days. And I'm very fortunate that I have a great friend who's a doctor in radiology, and she looks at boobs all day long. And she knows if it has cancer or not, or needs extra screening. And this special friend is also a breast cancer survivor. And we're going to get a chance to interview her now and ask her a lot of questions. So here she is, the lovely Jane Testa. Yay!
Hey!
Oh, Jane, I got an
Gina.
opportunity to meet Jane last year at an event called Peace, Love, and Vans. And Jane and I both have the same kind of van that's been converted into an RV on the inside by Embassy RV. And so we both travel in our Embassy RV vans, and we met at Peace, Love, and Vans, and she is a hoot and holler. I just love her. I just love her. And she's got a cute little dog too.
That's my dog. I'm sorry.
No, I'm hoping we get to see her at some point because her dog is just precious. Luca, is that his name?
Luca, yeah. Come here, baby. Come here.
Yeah, let's see Luca.
Come on.
He is a precious little thing, and he is her companion. And Jane is a solo traveler.
Let me just get her
in her van with your little puppy.
Okay, sorry.
No, it's all good. It's all me. So, hey, and the puppy just left.
Go lay down. Go lay down.
Oh, my goodness. Well, Jane travels in her Embassy RV as a solo female traveler, too, with her cute little dog. And she does radiology. And she can pop in different places and do radiology. So she's still working, but not as often. So that way she has plenty of time to travel too. And Jane and I, we really hit it off. And when she told me that she is a breast cancer survivor and a radiologist, I told her, you should have your own YouTube channel. You would be amazing. And I told Jane, if you started your own YouTube channel, number one, you would show women that there is life after cancer. And boy, Jane lives life to the fullest. She travels all over the place and has a wonderful time with her cute little dog driving around in her Embassy RV. And she makes extra money on the side, still keeping up with her radiology licensing, and she takes days where she looks at boobs all day long and makes sure that they're healthy or not. So we're going to ask Jane a lot of questions. And I told Jane, if you had your own YouTube channel, you'd probably be able to save someone's life. And if you took the time to do that YouTube channel, and if it saved at least one woman's life, it'd be worth your time. And she said, heck yeah, that'd be great, but I'm not quite sure how to set it up, Gina. So Jeff and I spent an entire day with her, and Jeff helped her create her banner and get all set up. And then we went to another meetup. We were at 2 meetups together, an Ocala, Florida meetup with just Embassy RVs and Peace, Love, and Vans side by side. So we got to know each other really well. And we even did a couple of videos together.
Yes.
That are on her YouTube channel. And I've put it on my new playlist, Mammograms and More. And we're going to be doing a lot with Jane. What I didn't realize, though, you guys, when I told Jane, hey, you do this for the power of one. That's why I do all my videos. I pray before my video that God will share it to at least one person who either needs to smile that day, or maybe they needed to learn something about type 2 diabetes, or not be afraid to take their first Manjaro shot, or help them apologize to a friend or family member, or forgive someone who has hurt them. So many different things that if I could just help one person with each video, that'd be great. And Jane said, I like your power of one, Gina. Let's do it. So we did. It is now a year later. It is time to go to Peace, Love, and Vans again in Florida. Jane's got her ticket to go. I've got my ticket to go with Jeff and I. Jeff and I were actually going to leave last Wednesday, and we were getting all set up to be on a 2-month RV trip, and we were so excited. And one of the places is Peace, Love, and Vans, where we get to hang out with Jane and her cute little dog again. And 2 days before my trip on Monday, I did my annual screening mammogram. My mammograms usually turn out fine. I've had dense breasts, so there has been times in the past that my doctor will call me and say, your breasts were too dense and we need another picture. And so then I have to go in and get a 3D mammogram. And then I do that. And then they look at it and they go, yeah, they're fine. We'll see you next year. One time, I don't know, like 7 or 8 years ago, they told me I needed to have a ultrasound and a 3D mam. And so I went back and I was so nervous. But then after they did the ultrasound, they said, it's fine. That was just, I don't know, a fatty lymphoma or something, but it's just your breast. You're good. Go home. We'll see you in a year. So on Monday, I did my regular mam a year to a day from last year. And I did it at 9 a.m. And I went to Costco with Jeff that afternoon because we had to buy a bunch of stuff to get ready for our 2-month trip in 2 days. And while I was at Costco, I got a phone call, and it was my gynecologist, and not her office and not her staff, my gynecologist. And she said, hey, Gina, I got your lab results of your mammogram. Good news. Your lymph nodes look great. And I'm thinking, why is she talking about my lymph nodes? And then she said, but they did see something. And we need you to get another mammogram, a good 3D mammogram, and an ultrasound. And I said, oh, I'm leaving in 2 days for a trip, because I'm still thinking, because when this happened last time, I did get scared when I had to have, I needed an ultrasound. It was scary. And I thought, do I have cancer? I don't want to have breast cancer. That's really scary. And I talked to my mom and I talked to my biological dad, and they both told me that no one in our family has ever had breast cancer. No one. We have, there's colon cancer in our family, but there's no breast cancer in our family. And so that made me relax and go, oh, okay. And sure enough, I didn't have cancer. I didn't even need a biopsy. Looking at it with the ultrasound, I was good. And so it's been a long time since I've needed a second look at my boobs. And so when my doctor told me while I was at Costco that I needed to get this ultrasound, I'm still thinking, I'm okay. No one in my family has breast cancer. And it's kind of an inconvenience right now because I have a lot of things to do to close my house and go travel for 2 months. And so I asked her, I'm going on this trip. I'm leaving in 2 days. I'm going to be gone for 2 months. Can I do it in April when I come back? And she said, oh, Gina, no, you really need to get this done right away. Please do it before you go.
And it would not have been fun to be on a vacation and have to worry about this the whole time.
Yeah. And Jeff loves me. He'd give up any trip if it's for my health. He would just cancel everything. He's been so supportive. And so Jeff was kind of mortified that I'd even ask, can I just wait 2 months? Because I'm really thinking it's a nothing burger. It was a nothing burger last time. It's going to be a nothing burger again. But she was very definite. No, you really need to go. So I was like, all right, fine. So where I had my mammogram was a mile away from Costco. What luck! So we bought our groceries, and then I told Jeff, drop me off at my mammogram place because it's just a mile away. And I said, and then go home, and you drop me off, go home, put away the groceries, and then come back and pick me up. And I'm just going to walk in and tell him, hey, let's get this over with. Do you have any availability this afternoon? And of course, it's already afternoon. They're booked. They have nothing that day. And then I said, can you book me something tomorrow? I'm leaving on a 2-month trip. And it's a work vacation too, because I'm doing some public speaking events and things. And so they said, well, we are booked solid here for the next week. But if you're willing to go to one of our other locations, there is an opening tomorrow afternoon at 1:00. So I was like, sign me up. That's great. So I get that appointment and still thinking I'm going to be good. I'm going to be good. Well, the next day I go to the other location and I get a 3D mammogram, and the machine was really similar to the other machine. I didn't realize it, Jane. But yes. I had a 3D mammogram the first time.
Yes.
I already had a mammogram.
Yes, that's the usual modality. Is a 3D
it the usual now?
Tomography. Yes.
Yeah. So I already had a 3D mammogram, but they wanted extra pictures. So they were doing extra pictures, and only of my right breast. My left breast passed. It's sailing good. But my right breast, not so much. So they took some more pictures, and then I got my ultrasound. And when the ultrasound technician finished, she said, we have a radiologist, just like Jane, in the back room, and he's with us right now, and he's going to look at him right now.
They said like Jane?
No. But that's what Jane is. Jane's a radiologist. But a radiologist just like Jane, I know. But they said, we have a radiologist. He's here right now. I'm going to have him look at this right now, and you'll know before you leave. And I said, oh, okay, well, that's nice. Because I'm thinking I'm going home and I'm packing because I'm leaving tomorrow on a 2-month thing. Well, the radiologist comes in and he says, would you mind if I take a look as well? And I said, oh, all right, sure. And so then he does the ultrasound, and he really, really is looking, and he's playing around. And they even take like a ruler and put a ruler by my breast, and play and play and play. And then he goes, okay. What it sounded like to me, Jane, I think he said, wah, 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 needle biopsy, wah, 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 wah. Right away. Wah, 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 wah,
yes.
wah.
Yes.
And I went, huh? What? And I said, well, can you do the needle biopsy right now? And he said, oh, I'm so sorry. I have other patients today, because it's our, I said, I have other patients today, and I'm booked solid for the next week. And I said, oh no, I'm leaving tomorrow on a 2-month trip. Can I wait till I come back? And he said, no.
Again, you asked that question.
Yeah. And he's like, no, you really should get this done. He said, but I will do this for you. He said, I'm going to rush your order right now to your doctor, to your gynecologist. Because it needs pre-approval to get the biopsy. And he said, so that way she gets it immediately. And then call her and tell her I just sent it to her. And so that way she can place the order for it. And that ought to help you along. And we have 3 locations where we can. And so I don't understand if this is what he said for sure, because really a lot of it sounded like wah, 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 needle biopsy. Wah, 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 wah. But he said there was 3 locations that have where they can do a 3D mammogram
Stereo or something.
while they're poking you with the needle at the same time. And they had 3 locations for Simon Med to do this. And he was one location, but there was 2 others. And he said, and you can see which one can do you first, but maybe someone else can do you quicker, but it's going to be at least a week here. So I said, okay. And so I called my doctor's office and spoke to a front desk staff, and they said she was in with a patient, but they would have her look, and they wrote an email and wrote urgent on the top. And sure enough, oh, I love her. I have a fantastic gynecologist. She not only sent it out right away, she called me.
Very nice.
And said she saw it, she got the report, and that I really need to get this done. And again, I asked, is it possible to wait 2 months? I'm leaving tomorrow on a trip. Can I wait 2 months for this? And she said, oh, Gina, no, you can't wait 2 months. She said, what you can do is, I send out the stuff. So call Simon Med and let them know I ordered it and I saw it and ordered it. And hopefully they can get you in quickly. And if they can't, do the earliest date and then call every day and see if there's a cancellation and maybe you can get in earlier. So I said, okay. So that was a week ago. And the earliest that I could get in was another location. Cool thing is, though, the address has 1111 in it.
Oh.
Yeah. So, and it's going to be on Thursday of this week. And we're recording this on Tuesday, and we'll probably let it go live tomorrow on Wednesday, the day before it. But Thursday morning.
That's really great, Gina. I mean, that's really great. I just want to say thank you for inviting me to Anchor Moments. I'm very grateful to be here as a friend, as an Embassy family member, as a radiologist who does mammography. And I'm really humbled by your invitation. But what you're saying and what you went through, many women have to scramble for a spot to get their mammogram. They have to wait. I feel a lump. They have to wait. We can't get you in for 1 week, 2 weeks, 3 weeks. And the radiology and and the powers that be are trying to answer that with more staffing, but things are tight, as we all know. So you're very lucky in one way that you got your mammogram and your doctor just advocated on your behalf to get a call from your doctor. That's great, and to have a biopsy within a week and a half. That's great.
A week and a half. Yeah.
That's great. And I think that was good advice. Just call every day and pester the hell out of them until you get your biopsy slot. That's a good idea. I might use that for my own family.
Sometimes I've called my doctor and couldn't get in, and I just thought, they open at 8 a.m. If I just happen to be there when they open and ask about anybody who canceled, I might just get a spot, and it's a win-win because they lost out because they had a spot that was empty, and I would win because I could fill it.
And he's won before.
A few times.
Yeah. Yeah, he's gotten lucky that way before. Not every time, but sometimes.
Yeah. That's good. So your biopsy is in 2 days. 2 days.
Yep. No one ever canceled. Everybody kept their appointments.
Because they needed them.
They needed them. There's a bunch of nervous Nellies like me.
And often, as you say, you often need, I don't know why, insurance constraints really hamper a lot of women in receiving their health care. But often, the insurance companies require this pre-approval. Now, if you have something wrong in your breast and you need a biopsy and it's recommended by your doctor or radiologist, that shouldn't be questioned. Or wait, we got to see if we want to approve it, but that's the way insurance companies work, and they usually is not a problem getting approval like you did.
Yeah. So, Jane, tell us a little bit more about yourself.
Okay, well, I'm a semi-retired. I retired from NYU, and I do about 1 week a month locums, working. This week, in fact, I'm working, and I love what I do, but I also love traveling. So yeah, that's what I do. I work once, maybe 1 week a month for some pin money, so I can fill my van up with gas and go traveling. and
Yeah.
and I'm very grateful to you and Jeff for being so patient with me and starting my YouTube channel, because I really want to show what it's like being a solo woman traveler, and having life after breast cancer. As you know, I was diagnosed with breast cancer. Mine, I put my mammogram up, and there it was. I saw my mammogram, I saw my breast cancer, and I, like you, had very supportive network that helped me get my biopsy right away. So, and that's me. And I chose, of course, we can talk about the treatments for breast cancer, but
Yeah.
I chose a mastectomy, and you know, and I chose to go flat, no prosthetic, no, reconstruction, no implant, no, autologous breast. So, and I'm happy with it, except I think I could have had a better cosmetic result, but maybe we all think that. So that's me, and I do my YouTube channel, and I called it One-Breasted Traveler, because I'm a one-breasted traveler.
Yes, you are. Yes, you are. And you're just precious. Let me ask you a couple more questions about your cancer journey before I read you my report to get it and have you answer a couple of questions about mine. When you saw yours,
Yes.
what did it look like that let you know, uh-oh, this isn't right?
Yes, that's a good question. And for me, as a woman and as a radiologist,
Mhm.
I noticed a change. That's why we tell patients, women, to get their mammograms every year, because over that year, you can compare it from last year to the year before to the year before and say, hey, look, there's a change here. And that's the red flag, a change. And so when I looked at my mammogram, I saw there was a change.
You saw that there was a change. Yeah, I always go to the same place, so they have all my slides there, so they can check that being a change. Now, your particular, I've heard that there's like 100 different kinds of breast cancers. There's like all different kinds of breast cancers. What kind of breast cancer did you have?
I had two of the most common breast cancers. I had DCIS, ductal carcinoma in situ, which means it's still contained in the duct. And I did have invasive ductal carcinoma, which is it exited out of the ducts.
Okay.
So those are two of the most common. And my cancer was an early stage in the DCIS, was an early stage that it was still contained, but also a part of it had already burst out of the ducts and was invasive.
Okay. And did it touch your lymph nodes at all?
That's the very next question that radiologists ask. Did it go to the lymph nodes? And all women ask that. Did it spread? And my lymph nodes, 5 were taken out and 5 all were negative. So
Oh,
I was
good.
very, very lucky.
Very, very good. And you are a radiologist and you encourage people to get their mammograms every year. Had it been just 12 months since your last mammogram, or was it a little bit longer? Doctor, heal thyself. Yes.
You know, every mammographer thinks they're going to get breast cancer, and every mammographer doesn't like to do their mammogram, but it was a little over a year. It was about a year and a half, maybe a year and a half. Yeah.
Okay. Okay. I will tell you, Jane, after I met you last year, it made me know I want to do it a year to the day, because health insurance will pay for that one for free, because that first one of the year, because it's a preventative medicine, but they won't do it less than 12 months.
Yes.
So when I tried to make my appointment, they knew when I did it last year, and I had to do it the day after, you know.
Yes.
So I did mine. You'd be proud of me, Jane. It was the very first day of 2026 that I could get my boobs smashed.
And then you wanted to put it
That's
off
great.
for 2 months.
Well, I was so good about doing it right away. Can I go on my trip for 2 months and then deal with this?
See, that's very smart, Gina, because I've had to turn like 89-year-old women away who made it, who took car service to get their mammogram because they came 2 days early. It's crazy, that rule, but so kudos to you for knowing exactly when to go.
Well, I asked when my gynecologist, she's outstanding and she's on top of things. And so I see her in January every year, and she tells, since I've had my hysterectomy, since right before my hysterectomy, I've had her as a doctor and I love her. And I see her in January now, and she tells me, get that mammogram done, and she writes the thing up. But when I call Simon Med, they don't let me do it until the day after from the year before. And I do it the second that they can do it is when I do it. So, so if I do catch something, at least I'm catching it quick.
Right.
So there is that. So ladies, get your mammogram and do it as soon as possible, because the sooner you do it, the less likely, if you have cancer, that it's going to have time to grow, and you want to nip it in the bud. So here's my next question for you. So you had 2 different kinds of breast cancer. What options did they give you? Because you don't get to make that decision. You had to have a biopsy. And then after you had the biopsy, where did you go? And how did that biopsy, did the biopsy say both cancers?
Yes, the biopsy, I had a 2-site biopsy because my cancer looked a lot more widespread than I would like. And so I had a 2-site biopsy. And often radiologists do that to say, well, what's the extent of the actual, suspicious lesion, right? So is it 1 inch and 2 inches? Is it 4 inches? Do a biopsy here and over there, like on this side and that side. So I had a 2-site biopsy, and both were positive. One was DCIS and one was invasive. So I knew that it was sort of it involved a lot of my breast. So my options were, I went to 2 surgeons. I had 2 surgical consults because, you want to shop around for a good surgeon. You want to feel comfortable with your surgeon. You want to feel welcomed by your surgeon. You want to feel your surgeon she or he is smart and well practiced and has good hands and listens to you and gives you good advice. So you have time to shop for a good surgeon because that's important.
Okay.
So I did. I shopped 2 surgeons, and the surgeon I decided on gave me the option of a lumpectomy or a mastectomy, and it was my choice.
Okay.
Mhm.
And you chose to go ahead and do the mastectomy.
Yes. Hmm.
Did they
Yeah.
recommend one over the other?
Well, it depends on what your tumor is, how aggressive it is, how large it is, what the size of your breast is. Like, I had smaller breasts, a 4-inch tumor in a small breast versus a 4-inch tumor in a huge double D breast. They look
Right.
different. So
Mm-hmm.
it all depends on the tumor and the aggressiveness of the tumor, what type of cancer it is. It's usually, though, invasive ductal carcinoma or DCIS, and, the extent of the spread in your breast. So it all depends on that. But I was given the choice of either one. Um,
Okay.
so
Did
I
they
chose,
also give you the choice to do a double mastectomy so you wouldn't have to worry about the other breast?
yes, they usually do your two genetic testing to see maybe you have the gene or not. And then, but if you have a diagnosis of breast cancer, usually most insurances will pay for a prophylactic mastectomy on the other side. They will.
Okay.
I mean, I may be wrong about that, but I believe it's true. And my surgeon said you can have a mastectomy if you want on the other side. She said it's going to be very hard to be asymmetric, flat on one side, breast on the other.
Uh-huh.
So,
And what are your feelings now? Are you glad you still saved your other one, or do you wish, maybe I should have just whacked them both?
well, I wasn't ready to lose both my breasts. I wasn't ready then. And I had plans for my other breasts. I had
Yeah, you said that
plans.
in the other video. It was so funny. Yes, you had plans for that one.
Plans. So,
Yeah.
but I had I had a plastic surgeon close me for a flat closure, and he did a bad job. I call it my pork chop. I have a pork chop there that should have been a better outcome, but it wasn't. So I'm thinking maybe I should, get that revised. But anyway, this is not about me, it's about you.
No, well, no,
But
actually,
but
when
I
people
I'm
come
thinking I
on, they
should
want to
get it
know.
revised
Yeah.
and maybe do this, but I don't want to. I don't really want to. I don't really want to lose my breast. And they give you all these options. Oh, don't worry, we can give you a prosthetic. We can give you an implant. You'll wake up with the feeling like you haven't lost your breast. Well, a water balloon under my skin is not going to replace my breast for me.
Hmm.
For many women, it's a very personal choice. A
Yeah.
personal choice. And for many women, it works. So it's a very personal choice.
Okay. Yeah, that's something I need to think about a little bit. Uh, but I really appreciate you really sharing exactly what your thoughts were and why you chose what you chose
Mm-hmm.
for that. Now, how many years ago was your mastectomy?
It was it was uh, 4 years ago.
Has
It was
cancer ever come back?
August of 2022. Yeah.
Okay. Has
No, no,
So
no.
yay. So 4 years
Yeah,
cancer
yeah,
free.
yeah. 4 years cancer free. Yes,
Did you have
yes.
to do chemo or radiation after your mastectomy?
No, usually you can have radiation with a lumpectomy. They often want you to have radiation with a lumpectomy to protect any residual cells that are there, to protect them from growing, or to prevent any recurrence, local recurrence, they call it.
Okay.
And but I had a mastectomy, so I didn't need radiation. And my oncologist offered me had some options, but it was gonna if I went on chemo, it would have been you know just prophylactic, preventing any new cancer or recurrent cancer, and that would have been like 2% chance risk. And
Mm,
I didn't think it was worth. She gave me the
worth.
option.
Yeah.
being on chemo or not, and I didn't want to be on chemo.
I don't blame you. I don't want to do chemo either if I can all help it. Because that's kind of scary too, because it kills good cells as well as bad cells.
Right. But
So it's scary.
you don't know. You don't know.
It depends what kind of cancer I have.
Depends
If I have
how
it.
aggressive it is. It all depends. And, my oncologist gave me the option. Another woman might not have the option. They might say, you need the chemo.
Mhm.
You need the chemo. So I was lucky.
Okay. And you were lucky and didn't need that. And it's been 4 years and cancer has not come back.
No cancer. No
Oh,
cancer.
that's fantastic. I love hearing that. Yay.
Yes, yes.
Yes. And
Yes.
seriously, you guys, check out her YouTube channel, One Breasted Traveler. And the traveler part's really important because it's a multifaceted channel. And she's just starting to add some new videos. So it's not super big yet, but it will be. And she has some fun things that she's seeing while she's traveling, having a wonderful time, showing that there's tons of life after cancer. And then she also has some videos about what it's like to get a mammogram and what it's like to need some of these other things, like what I'm going to need on Thursday, a breast biopsy. And do you do breast biopsies?
Yes.
Okay.
Yes, I do. Yes.
So you do it. And it was, did I hear him
Can
right?
you come by before Thursday?
Yeah. There you go.
I know, I'd love to have Gene. So when you do a breast biopsy, so will my boob be like smashed in the machine and then the needle goes in while they're looking, or how does that work?
Oh, okay. Well, that's a good question. There are findings on your mammogram,
Mhm.
and there are findings on your ultrasound. And
Okay.
often they match. What they see on your mammogram looks like this on your ultrasound.
Mhm.
So if they see a mass on your mammogram, they can do an ultrasound and see that same mass.
Mhm.
And
Which they
then you
did.
have a choice of how to biopsy it. Let's say we decided that when it needed to be biopsied, you could have it with a mammogram, what they call a stereotactic biopsy, and that's where you're in something called a stereotactic biopsy, where you're in compression. They use mammography and a computer to target on the lesion, target on the mass, and do a biopsy that way. But if they see it by ultrasound, they can also do it by ultrasound, and that's sometimes a little bit more comfortable for patients because they're not sitting up and getting their biopsy this way or lying on a table with their breast going through an opening. And getting biopsy, they're just lying flat on an ultrasound table, and the radiologist comes and does the biopsy that way. So there are sometimes the type of mass it is gives you options. If you have calcifications in your breast, that's only usually seen by mammogram, and so you don't have a choice. You have to get what they call a stereotactic biopsy, in other words, using mammography and a computer to zero in and target on the calcifications, the area of interest.
Okay. Well, I remember when my radiologist told me what I was going to get, it did sound like wah, 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 wah. So I'm not entirely sure, but it sounded like it was going to be, they were going to do a mammogram with a needle at the same time.
I think
But
she
it
said
was
something about stereo something.
Yeah, but it was really hard. So I'm going to read you my report and see if you can figure out
Okay.
what some of this wah, wah, wah really meant.
Okay.
I also have a friend that lives in my cul-de-sac who's a retired nurse practitioner, and she's a breast cancer survivor. And she's wonderful. And she came over and she said, Gina, do you have the report? Can I read? Would you mind if I read the report? And I said, I don't know if I have a report. And she said, do you have a patient portal? And I said, yeah. And she said, You mind opening that up and see if it's in there? And it was. And so this is what it said. So let's see. February 9th, screening mammo, bilateral W/3 exam. What is a W3?
I don't know. W3/what?
W/3.
I don't know. It's probably a 3D mammogram.
Oh, okay.
Pinch a
Okay.
little bit.
This way?
Yeah. No.
Nope.
Okay.
Clinical history, screening mammogram. In comparison, there are no prior exams available for comparison. Actually, that's not true because I always go to the same location. So my stuff should have been there. Technique,
On your phone.
bilateral, full.
Other way. No.
No, doesn't want to do it that way.
Doesn't rotate
Nope.
to the right.
Oh, there's more stuff.
I know.
Oh, okay. I'm sorry. I got to reread that. There was a lot more stuff.
3D tomosynthesis.
Oh, yeah. 3D tomosynthesis. So it was a 3D
Yes.
mammogram.
That's a 3D, yes.
Okay. It's a screening mammogram. Encounter for screening mammogram for malignant neoplasm of breast. There are no prior exams available, but actually there should have been because I did it last year at that location. Technique, bilateral, full field, 3D.
Tomosynthesis.
Digital mammography was performed, mediolateral oblique and craniocaudal
Caudal.
views. Yeah, that. Both breasts were obtained. It was a standard 3D views of both breasts are submitted with synthetic
Tomosynthesis.
generated 2D images as well. The exam was interpreted with the aid of AI, CAD, computer-aided detection. Do you do that sometimes?
Yes, everyone uses that. Computer-aided detection, yes.
Okay. And then it says...
Computer-aided detection just gives you like a little dot or a dash or a star on something that the algorithm says, let's take a second look here.
Oh, okay.
So it sort of flags areas in the breast on the mammogram that the radiologist should look at again.
Okay. The next part says breast density. There are scattered areas of fibroglandular density.
Yes. So there are 4 categories of breast density: fatty, scattered fibroglandular density, heterogeneously dense, and extremely dense. Those are the 4 categories. And if you fall into heterogeneously dense or very dense, extremely dense, sometimes it's good to get an ultrasound to help, as an adjuvant screening.
Okay. And that's what happened to me a few years ago. They said my breasts were too dense, and then they made me do a 3D scan and ultrasound, but it came out just fine. They were just fine. Okay, findings. There's a 2.3 centimeter irregularly shaped focal asymmetry in the 3 to 4 o'clock right breast, 6 centimeters from the nipple, with a suggestion of spiculated margins on 3D
tomosynthesis
imaging. There is no evidence of a worrisome mass. Oh, good. So it says there's no evidence of a worrisome mass or architectural distortion in the left breast. Oh, yeah. My left boob's fine.
Oh, okay. Yeah.
Yeah, I already knew that. Breast arterial calcifications are not evident. Is that good?
Yeah, that's good.
Okay. Suspicious calcifications, thank you, are not seen. There is no mammographic evidence of malignancy in the left breast. Well, yeah, I knew my left boob's good. Impression. The 2.3 centimeter irregularly shaped focal asymmetry in the 3 to 4 o'clock right breast, 6 millimeters from nipple with a suggestion of spiculated margins, is indeterminate. Full field 2D and 3D
tomosynthesis,
medial lateral views and spot compression magnification views and targeted ultrasound are recommended for further
characterization.
Thank you. And then it does say, according to the Tyrer-Suzik or something,
Yes.
VA breast cancer risk assessment tool, her lifetime risk of developing cancer is 7.2%, which is nice low percent, but nobody in my family, mom's side or dad's side, has had breast cancer. Let's see. And they want me to get extra exams. I don't think is there anything else? Pretty much all of that. I think that's pretty much it for this first one. And then it has the name of the radiologist is on it. So like you put your name on all your stuff too, right?
Yes, that's for the lawyers. No.
Oh, yeah.
Yes.
All right. Then I have the one the next day.
So you were called what we call
right breast.
call back. You were called back. That's what the dreaded callback. You were called back.
Yes.
So they told you something was wrong. They saw something. You have to come back and do more imaging. And so they usually do some spot views and they usually do an ultrasound when that happens. And the funny thing about if I could just say, the funny thing about your report is that he's, when you see something on two views, if you see it on this view and that view, this view and that view, then you can call it a mass. He didn't, or she did not call it a mass. They called it an asymmetry, and that's something that you see only on one view. So that's why he said, well, you need a further workup. He didn't call it a mass, Gina. So
that's a good thing.
It might be a good thing. Yeah. Yeah.
And they said there was no shadow too, right?
Well, that's on this next one. So now
no abnormal calcifications and no lymphadenopathy was seen. So those are all good indicators. So
I like that. Okay, so then the next day they took more pictures of only my right breast because the left breast is good. And it says, and it was located at this other location. Indication, irregular focal asymmetry with suggestion of spiculation in the right breast near 3 o'clock.
Now, spiculation is a bad word. That usually denotes something very worrisome. Cancers are spiculated, so that's a worrisome thing. So go ahead. So I'm sorry to interrupt you.
No, because that's what my friend who's a retired nurse practitioner told me. She said that spiculated is why your doctor called you. And you heard from your doctor and she wants you to get it started right away, is the word spiculate, that it's spiculated.
Yes, that's a cancer word.
Yep, and that it was asymmetrical.
Yes.
And then it said about the prior mammogram and standard, say that word again.
Tomosynthesis.
Yes, tomosynthesis and synthetic tomosynthesis generated 2D mammographic views of the breast are submitted. AI 3D computer aided detection and eye reveal breast density analysis were utilized to evaluate this exam. Targeted ultrasound of the medial aspect of the right breast was performed in the area of concern. And then, okay, I think that was the technique. Breast density. There are scattered areas of fibroglandular density.
Mm-hmm. So that's your category of breast density, scattered fibroglandular.
Okay. Right mammogram, the focal asymmetry with poorly distortion in the medial aspect of the right breast near the 3 o'clock location does persist on today's study. This area will undergo ultrasound to further evaluate. Right breast ultrasound. There is normal breast. Okay, what's that word?
Parenchyma?
Parenchyma.
Parenchyma?
That's what it is, parenchyma. There is normal breast parenchyma with no suspicious cystic or solid masses or areas of shadowing.
Beautiful.
Yay, so that we need. Good, good, good.
So that's a good thing.
Good. And it says normal lymph nodes are identified. Also good. With thin cortex and fatty hyla?
Hyla.
Fatty
Yeah,
hyla.
Yeah, so when a lymph node looks abnormal, it could be a normal size, but if the cortex is thickened, and we use in radiology, we use 3 millimeters, 4 millimeters. If it's thickened, then that's suspicious. And you have normal lymph nodes and normal cortex, so that's good.
And
That's
normal,
normal.
And normal fatty hyla.
Which is normal.
Okay, so that's good. Okay, that makes me feel a little better. And then it says focal asymmetry with possible distortion in the medial right breast near 3 o'clock, for which stereotactic core biopsy is recommended. So what's stereotactic core biopsy?
Okay, so stereotactic core biopsy is where you usually they have a prone table where you're lying on your stomach and your breast goes through an opening, or they sometimes have an upright one. I don't know what your facility will have. I like the prone one because it's easier to lie down than it is to sit up while my biopsy was sitting up and I didn't like it. But nonetheless, there are two ways to biopsy the breast. When we see an asymmetry, usually like in only one view, and because it uses a computer to help you target on this asymmetry, that's why it's called stereotactic. So it uses a computer to sort of target on your asymmetry. So you're going to be lying. Let's say you have a prone table. You're going to be lying on your stomach. Your breast
Okay.
goes through an opening. You're in compression because that's the only way you saw it. You didn't see it by ultrasound. By ultrasound, they saw nothing.
Oh, that's why the radiologist came out probably and did it, because he wanted to get a better look.
See if there was something, and they didn't see anything that they could biopsy. They didn't see a target, but they saw an asymmetry on your mammogram. Then when they called you back and they did spot views, they said, well, this asymmetry persists. It doesn't press away and it's just normal parenchyma. It persists. So that's why they do a stereotactic. You're lying on the table, your breast is in compression. They use a computer to target on that asymmetry, and then they numb you up and put the needle in and take samples. And the samples are very interesting because they go in like a clockwise, so they can take it at 12 o'clock, they could take it at 3 o'clock, they could take it at a little sample at 6 o'clock. They go like round robin around your breast and take sampling of each little area. So it's nice because not that the needle moves, but it just whirls around, it twirls around, it moves, not moves, but you can spin it around like a clock. And then some radiologists take 3 samples, some take 12 samples, it depends. And then that gets sent to the pathologist, and the pathologist will look at it and decide. A pathologist is a doctor schooled in breast pathology, and then he or she decides what it is. Is it benign? Is it something atypical? Is it lobular atypia? Is it atypical? Is it cancer? Is it a lobular cancer? Is it an invasive ductal cancer? They have the cells in front of them and they can decide what it is. Usually at the end of your biopsy, they put a little clip in to mark the area. And in your case, it's especially important because they don't, it's kind of a vague finding. It's asymmetry. What is it? So they will put a clip in, and that clip will be used if, you need to have surgery. They can use that as a guide to locate the area that was biopsied and excise it.
Yep, because they did say he did say they would put a titanium clip in, because I heard that it was want needle biopsy want titanium clip want. I'm like, holy
See, this
crap.
is good for me to know what you hear. Sometimes when I tell patients, I say it like twice, and I say it like in two different ways. So yes, but now it's not good to know that all they hear is what.
Yeah, and the needle biopsy, we know that word.
If you're nervous already.
Oh yeah.
that-
And I didn't have Jeff in with me because I left him in the waiting room because I thought, well, I don't know. And I'm still thinking it's a big nothing burger. So I'm like, just wait in the waiting room. I don't think, husbands come in for this one. Just wait out there. We'll be okay. And then when he came, that's why it's usually good to have someone with you. So when you're hearing want, the other person might be able to catch what is really being said to you,
Absolutely. Yes.
Okay. And then it says, okay, so the stereotactic core biopsy is recommended. This does not have a sonographic correlate. What does that mean?
That means that they didn't see anything on ultrasound. There's no correlate for the asymmetry on the ultrasound. So you need a stereo because they can't do an ultrasound because they don't see anything on ultrasound.
So that's why when the lady did it and she went back to see the radiologist, and the radiologist came out and said, let me take a look. Yes. And so he was looking for it, but he couldn't find it. He only could see it on the mammogram.
So you had two people looking for that asymmetry that they saw on the mammogram on your ultrasound, and no one saw anything.
Oh, see, because I didn't understand that, but that's what that means, right? This does not have a sonographic correlate. Okay. Stereotactic biopsy is recommended. This was discussed with the patient at the time of the exam. Yeah, he said it, but it was wah. And then it says BI-RADS, BI, all capital letters, BI dash RADS.
That's the official MQSA BI-RADS category, how you categorize
that was
the assessment.
BI-RADS 4.
Right, which means suspicious.
And that's what it says in capital letters. Suspicious abnormality. What does it say?
Abnormality.
Abnormality. Suspicious. See, I don't normally say that word. Suspicious abnormality. Biopsy should be considered. And all of that is in capital letters. Everything there.
You wouldn't say abnormal, Gina. You would say I'm above normal. You're you're super normal. You're never abnormal. You're beautifully normal.
Oh, thank you. And then it says, in compliance with MQSA regulations and ACR guidelines, a letter stating the findings of this exam is being sent to your patient. I haven't gotten the letter yet, but it is in my file in my HELOC. Helo app. So it is in that. Income. Let's see. I think that is it. Thank you for your kind referral. And then my buddy. Yeah, and that's it. That's what we got. So what do you think?
I think that, it sounds like it's not a definite mass. It's an asymmetry. And, and you do need, in my opinion, from what I understand, having looked at your films, you need a biopsy. There was a change. We don't like the word spiculated. That doesn't, that's not a good word. That really is suggesting of a cancer. But it's nice that they didn't see anything by ultrasound, because sounds like, it's not this big mass, this 1-inch mass that you could see with ultrasound. Usually, if it's there on the mammogram, you could see it on the ultrasound.
Yeah, and it
In
was
your case,
2.3
you can't.
centimeters on both mammograms, and it was 2 different locations, 2 different people taking the pictures, and both times it says 2.3 centimeters, whatever it is they're looking at.
Right. So, and that's what, about an inch. That's about an inch
Yeah.
big. Yeah.
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 And I can't feel it. So I've been trying to see if I can feel it, but I can't feel it.
It's a small size. Usually things around 2 centimeters, you really can't feel. You can't feel.
Okay.
So you can't, but it's small size. It's an asymmetry, not a true mass, but was still, it's an asymmetry that wasn't there. It is a change. They do see speculation. So you have, red flags and, some red flags.
Okay. And some things not as bad as it could be. Just kind
And
of.
some things not as bad as it could be. I'm sorry. Yes. But I mean, you know how many women get biopsies, get biopsied a day?
No.
28 to 4,400 women get a biopsy every day.
Wow.
Across the whole US.
Okay.
And of those,
Yes.
850 to 900 are positive.
Okay.
So even though you're getting a biopsy, it doesn't mean 100% that it's a cancer, but I'm just saying.
Right.
And
So
it's over a million annually of biopsies. Over a million.
so 1 million biopsies.
But that's
and
from
those-
Chat GPT. So if I'm wrong, it's Chat, not me.
Okay. And so when you do your biopsies of
Yes.
someone with a spiculated mass, like a 50-50, about 50% no, 50% yes for cancer?
Well, if it's a mass, it depends on the margins. Sometimes the margins are very, very smooth, and that's not as worrisome. And sometimes they're spiculated, which is more worrisome. So I can't say 50-50, because we usually don't biopsy if it looks smooth. Maybe sometimes we watch it. Maybe they have it's something called a fibroadenoma, and they have 3 or 4, in one breast and another 2 in the other breast. That's not a cancer, because cancer doesn't present with 3 or 4 masses in each breast. It presents with usually one spot, one side, right?
Okay.
So when I do my biopsies, if I'm doing an ultrasound guided biopsy, I would say maybe 60% are going to be suspicious enough to say that, oh, this is a cancer. But I'm very humble. I'm very humble when it comes to saying, whether this is a cancer or not, because, you can always be surprised. So I say it looks worrisome, and we'll see what it is. Sometimes you absolutely know by the way it looks, whether there's malignant calcifications in it, whether, we see also an enlarged lymph node. I mean, and then that's going to be positive, and, your heart goes out to the woman. That's,
But I didn't have some of those things, so that's good.
but you had none of those things. You had none of those things. So that's a good thing.
Okay.
So you're like quite a dilemma. This is we're gonna have to see what your biopsy shows.
Yeah. So it'll be a surprise.
Now, if Gina asks me, Jeff, can you come in while I do the biopsy? Doesn't sound like that's the sort of thing I should be in the room for, or what are your thoughts?
They're not going to let you in the room. I never let husbands in the room because then you have two patients, the patient and then the husband who faints. No.
Yeah,
Yeah,
that's what I thought. See, like,
No, but
that's
it's radiation and you really that you can't go in the room. You can't.
well, that's what I was
I mean,
thinking.
they may let you, but I don't. I don't as a
Okay.
radiologist. Don't.
okay, that's good. That's good to know. That's good to know. Because, like, when Jeff gets his cystoscopy, I'm in,
Cystoscopy.
yeah, I don't know. When they put the camera up in his bladder, I'm in the room for that. And Jeff
No
wants me to
radiation.
be in the room for that. So that way I could be listening to what the doctor has to say.
There's no radiation.
But
for
there's
that.
no radiation for that. There's
And it takes
space for
about
me. I
10
sit in a
seconds.
chair. There's a chair in there for me to sit in. And yeah, and his doctor, he's in and out in 3 minutes. I mean,
really?
he's very fast. He's
Really?
and he has
And he saved
tons
my
of
life.
patients, and he saved Jeff's life. He's a fabulous surgeon, but he's not a talker. So he does his thing, and then he says, blah, 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 and then he's out. So it's quick. It's quick. And so it's good to have me there to also listen, go, yeah, no, he said you were fine, Jeff. You're good. We got another 3 months. And now Jeff's 2 years cancer free. So he just needs
That's great.
every 6 months now. So we're really excited about that.
See, I'm 4 years and you're 2 years, Jeff. Maybe, we should have a beer together. That's what we should
Yeah, at Peace, Love, and Bands.
Exactly.
And another question I have for you. So when I talked to my neighbor, she said that be prepared that, because it's spiculated, that there's a good chance they're going to want you to get it out. It might still just be precancerous or something, but they probably would want you to get it out. And that you would, your doctor would give you the names of a couple of surgeons, and you have to have a meeting with them, and they don't do it the day of your meeting. And then they have to schedule out, and it might be a month or more before they can do the lumpectomy or a mastectomy and, or whatever. Does that sound about right to you?
Yes, like it may not be invasive cancer, it may not be DCIS, it may be something called LCIS, lobular carcinoma in situ. It may be something called atypia. But those usually come out. Usually they recommend surgical excision for them. You can discuss it with the surgeon as to what you should do. But atypia usually always comes out. Lobular carcinoma in situ comes out often. I've seen it recommended that it comes out. There are other lesions like a papillary lesion, a papilloma. Does that come out? They're still deciding about that. Sometimes they say absolutely it comes out. Other times say if they see the whole specimen in the core biopsy, they recommend it. But that's up to usually like the facility, the university, what standards they accept, what the surgeon decides on, what they want to do. But yes, personally, if I had any atypia in my breast, I would take it out. I definitely would want it excised because you don't know what's sitting adjacent to it. That there's this. You're just taking a sample. You're not taking the whole thing. So what the core biopsy shows, if it shows some atypia, right next to it might be a cancer. I don't know. So I would take the whole. I would do an excision if it were me. If it were me, I would do it. And that's what's recommended usually with atypia. So it depends on what they find, what
Okay.
the pathologist sees.
Okay. Because if there was a month between seeing a doctor or seeing a surgeon and a month before the surgery, I might have time to take off and go to Florida and go to Peace, Love, and Bands and then turn around and come back.
That's not the priority, though.
But I actually, because I was shopping for surgeons, I was biopsied in early June, and I had my mastectomy in August.
Wow, it took a while before you finally got it.
Yes, because I wanted to be comfortable with my decision and with my surgeon. And so, you know, I also got a breast MRI, which is important to do. So all those things took time, and I took time. And I was still working full time then. So
Wow. Wow. Okay. Because I'm just trying to figure out, so I really
so
want to go
maybe you
to the
can.
band and Ocala meetup. I've been so excited about it, Ocala, and to see you, and all of our
And
embassy
oh
friends.
yes, all our embassy family, absolutely.
Yeah,
Well, you and Jeff and your doctor can discuss that.
absolutely. Well, Jane, it's been so nice seeing you.
It's
And
been great. Thank you.
and I made a promise to my shipmates. That's what I call my people who love to watch anchor moments. They're my shipmates, and I told them that if it turns out that it's not cancer and it was a nothing burger that just made me worry for nothing, I would still keep my mammograms and more playlist. And I would ask you if you'd be willing to once a month do a live Q&A on my channel. So my shipmates could ask you questions about mammograms and biopsies and being a breast cancer survivor, any questions that they'd want to ask. Would you be willing to do that with me once a month?
Oh, I would love it. I'd be on it. I would love it. Yes.
There's a beer in it for you.
Oh, there you
Yeah.
go.
Yeah.
Okay, put your hand up.
Yeah.
There you go. Thank
Yeah,
you.
then grab it. Yeah, so Jeff's got a couple of beers he's going to put in the van to be all ready for us to celebrate, so we can have a beer in at Peace, Love, and Vans and celebrate my not having cancer, which hopefully is the case. So
Yes.
thanks
I'm
so
so
much,
sorry you're
Jane.
going through this, though, as I am sorry for all women who have to go through this. And, whatever the outcome, you're going to get through it. And, everything's going to be not, I hate to say this, but I think everything's going to be okay, Gina. That's what I'm
Yeah,
feeling in my heart. So, I mean, you're such a good person. You're having your anchor moment right now, I guess.
yeah,
And 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 I think that you have the strength to get through this biopsy and whatever the outcome is for whatever the biopsy shows.
yeah. And it really is an anchor moment. It was there's 500 vans, you guys, at Peace, Love, and Vans. And there was a lot of people to meet, and I didn't meet everybody. I met a lot of people, but I didn't meet everybody. And for me to be able to meet Jane and to
There you
have
go.
us get inspired to give her the big push, you got to do a channel. We'll even set it up for you. I'll teach you how to do it. Let's do it now. And we, created the first videos right away and took
Yes.
time to put it up. And me telling her it's for the power of one, Jane. There's going to be at least one woman this is going to help. And then a year later, the person she helps is me.
And what did we chant? What did we chant at the end, Gina?
Go get your mammograms. That's right. That's right. Yes.
That's right. Go get your mammograms. All right. Oh, Jane, I love you bunches.
I love you too. I love you. You and Jeff are great.
Oh, thank you. And go check out Jane's and go become a subscriber of Jane's wonderful travel channel, The One Breasted Traveler. And you can ask her questions about your mammograms too. All right, everybody, hold on to your anchor moments and make it a great day. And get your mammograms.
Get your mammogram.
Yeah. Bye-bye.